red and some blue. But not always. You see the blue more clearly than the red on most of these. The interlobar is going to be between the pyramids. You can see some of them right here, here, and here. Same is true on the other side, in between the pyramids. Those are the interlobar arteries and veins. And then we have the arcuate arteries and veins, and I like to remember those because arcuate sounds like arch. And this is like a little arching vessel, and that is found between the cortex and the medulla. Okay, arcuate. And the cortical radiate arteries and veins, those are going to be in the cortex. So all of these little vessels, again, mostly what we're seeing are the blue ones, but you can see some red. Those are the cortical radiate arteries and veins in the cortex.
And like in the human, if we wanted to call them interlobular, could we?
Correct.
Okay.
Yes. That actually used to be on the list, but apparently somebody thought that it was too difficult to keep interlobar and interlobular straight. So to make it easier for the students, they just took that off the list. But that is correct, yes.
Okay.
Cortical radiate can be called interlobular artery or vein. Okay? All right, the renal pelvis is just the enlarged portion of the ureter. And if you can see on this side, you can see that the ureter is attached, and we have this enlarged region right here. Okay, that is the renal pelvis. Renal calyces. On the human, you need to know minor and major. On the pig, you see that your note says renal calyces in general. So if we're pointing to anything out here in this lighter colored region, those are the renal calyces. Okay, in general, you don't need to know minor and major for the pig. Renal columns, again, those are bits of the cortical tissue that comes down in between the pyramids. So renal columns, they're not really easy to see, but you can see a pyramid here and a pyramid here. And this area in between the pyramids, those are called the renal columns. And then renal pyramids is next on the list, and those are these somewhat triangular shaped structures in the medulla. Renal pyramids.
Dr. Ann,
Yeah.
what would be the difference, just because you're kind of pointing to the same areas, when you go to tag renal calyces from renal columns, or will the question be worded differently?
No, I think we would just say name the structure.
Okay.
But you said between the calyces and the columns?
Mm-hmm.
Okay. Calyces are going to be out here.
Okay.
You see your pyramids here?
Mm-hmm.
And then the calyces are out here. The columns are in between
Okay.
the pyramids. Okay? Does that clear it up?
Yep.
Okay. All right, and then the renal papilla is going to be the tip of the pyramids right here. The very tip. Those are the papillas. Okay? Any other questions? I'll leave these out so you can look at them up close, okay?